The prostate is a vital element of the male biological reproductive system. It's about the size and shape of a walnut, but if left unchecked, this small gland can cause big problems. Prostate cancer is one of the most common cancers affecting people with male reproductive organs. About 1 in 9 people with a prostate will receive a prostate cancer diagnosis during their lifetime. This includes men, transgender women, intersex people, and non-binary people with biologically male sex organs. One of the best indicators of whether you're at risk for prostate cancer is your family history. You're 2 to 3 times more likely to get prostate cancer if your biological father, brother, or son has the disease. Another risk factor is age. Your chances of developing prostate cancer increase as you get older. It's most common after age 50, and more than half of cases occur in people over age 65. There are some other risk factors too, including race, weight, and whether you smoke. But the reality is that prostate cancer can and does affect men of all backgrounds and lifestyles. Early-stage prostate cancer rarely causes symptoms, but as the disease progresses, you may experience certain warning signs. So what should you be on the lookout for? Knowing the symptoms of prostate cancer will help you keep an eye out for any concerning changes to your health. Keep in mind, though, these symptoms do not indicate trouble with your prostate. And in fact, most all of them come standard with aging. But if you experience several symptoms or have other concerns, it may be a good idea to visit a urologist. Most men will have trouble urinating as they age. You might experience a slow or weak urine flow, or your urine flow might start and stop beyond your ability to control it. Though this isn't usually due to prostate cancer, it may be a good idea to get your prostate checked. A rare but early sign of prostate trouble is unexplained pain in the area of your prostate, especially when you're sitting down. This could also indicate a prostate infection, but only your urologist can say for certain. A tumor on the prostate can put pressure on your bladder and urethra. So take note if you start to feel a frequent and sometimes urgent need to urinate, especially at night. You might also feel pain or a burning sensation when you urinate, a condition known as dysuria. This condition is most commonly associated with urinary tract infections, but it can sometimes be a sign of prostate cancer. You could experience a loss of bladder control, as well as problems controlling your bowel movements. It may hurt when you ejaculate, or you may not be able to keep an erection. And you may notice blood in your semen or urine. Finally, as prostate cancer progresses, it may cause pain in your lower back, hips, or chest, as well as numbness in your legs or feet. Again, none of these is a surefire sign of prostate cancer, but they might warrant a visit to the urologist. There's no way to eliminate your risk of getting prostate cancer, but if you're at higher risk for developing the disease, there are steps you can take to lower your risk. Get regular prostate screenings. Maintain a healthy weight. Exercise regularly. Eat a nutritious diet. And quit smoking. Prostate cancer is a serious disease, but early detection is key. Talk to your doctor about your risk factors and when or if you should be screened for prostate cancer.
You are tuned into Must Talk, where we discuss stories, issues, trends, and just about everything that IQMK Global I partners and people who are getting into entrepreneurship must talk about in starting and progressing in business and in improving themselves. Please welcome IQMK Global's Vice President and COO for Asia Pacific, Ms. Peachy Martinez.
Good morning, good afternoon, and good evening, wherever part of IQMK Global world you are. To those who do not know me, I am Peachy, a working mother. I have 3 grown kids, I love traveling for work and leisure, and I adore shoes. I devoted most of my life promoting better life experiences for all of us through wellness and supporting people's ambition through the work that I do. So today, we are going to delve into a topic that's a crucial for every man's well-being. That is prostate health. The prostate is a small, mighty organ, plays a significant role in men's reproductive and urinary system. As we explore in this important aspect of men's health, we'll be joined by a seasoned medical professional who will guide us through the intricacies of maintaining a healthy prostate. We'll also be addressing questions like the signs and symptoms of prostate issues, the impact of age and family history, the role of lifestyle choices in prostate health, and much more. Whether you're a man looking to prioritize your health or someone seeking a deeper understanding of this often overlooked aspect of wellness, this episode promises valuable insight. So stay tuned as we embark on this journey to unravel the mysteries of prostate health. Stay tuned for expert advice and practical tips and a conversation that aims to empower and inform. Welcome to Mass Talk. So today, before I call on our medical doctor guest, we would just like to share with you a testimony of one of our eye partners who have the same issue, the prostate. So let's hear his story first, then we'll discuss with Doc how this prostate really affects men, no? And ano ba yung importance ng prostate health. Okay. Justine, can we play the video?
Good morning po. Ako po si Juan Francis Barroso from Lagro, Quezon City. As of now, I'm already 71 years old and I'm the president of Meralco Employee and Retiree Association of Meralco. So, I started po nung nagpa-exam ako first quarter of 2022, that is June. Ang PSA ko po is 9.04. That is 2022. Then first quarter of 2023, around June or July, nagbiglang nag 14.04. So, advice sa akin, magpa-check up ako sa Medical City or Cardinal para malaman kung anong gagawin ng doktor. So, since I'm taking Atipros at saka Prosilac, yun po ang maintenance ko na binigay sa akin para sa PSA ko, that is for benign prostate. Kino-continue ko lang pa rin yung gamot na yan sa akin. Noong October 25, Muscadine was introduced in our company. Nag-take po ako ng capsule twice a day, one in the morning and one in the evening. So, that was October 25 when I started drinking Muscadine. December 17, nagpa-check up ulit ako ng PSA. Nagulat ako kasi from 14.04 naging 6.04 na lang yung PSA ko sa exam ko. It was, the examination was provided with us by Cardinal Santos Hospital. Yun po ang hospital na nag-kuhan sa amin, nag-check ng PSA. Kaya I was very glad na Muscadine was introduced in my life. At least malaking tulong po ang nagagawa po sa akin. So, yun lang po. Marami pong salamat.
Yan. So, I know a lot of people katulad ni Engineer Barroso have the same issue. That is the reason why we felt the importance of having this topic for our mass talk today. So, as mentioned, we have a special guest. He is a graduate from St. Luke's Medical Center, College of Medicine in year 2016. And in 2019, he was conferred as a diplomat of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He is also a consultant at Simply Healed Medical Group and ALTA Integrative Medicine and Wellness Complex at Perpetual Health Medical Center in Las Piñas, where he manages patients with cancer and metabolic illnesses. Let's all welcome on the program Dr. Jansen Kalalan.
Hi, Miss Peachy. Hello, everyone. Happy to be here.
Yeah, good morning, Doc. How are you? I know, busy, but thank you for accepting our invitation to be one of our guests sa aming Mass Talk today. Yan, Doc. So, narinig naman natin yung yung concern or issue ni Engineer Barroso. Can you explain the importance of prostate health and why it is a crucial topic for men?
Yes. So, kasi ang prostate ay, it's unique for men, no? So, lalaki lang ang merong prostate. And the reason why it's because the prostate is the one that produces testosterone. It is what makes men physically. Okay? And aside from that, since yun, located siya no, just below the urinary bladder, kapag lumaki siya, it can impede urinary function. So, it's very important na ma-maintain yung prostate health kasi kung hindi, ang problema dyan, magkakaproblema ka sa urination. And when your urination is affected, ang laki ng impact sa quality of life. Kasi mayat maya, gigising ka sa gabi, ihi ka ng ihi. During daytime, when you are doing your work, you're going on about your life, mayat maya, punta ka ng punta sa CR, no? And aside from that, ang bilis mong you can feel difficulty in urination. Okay? So, another very important aspect is sexual life, yung sexual function. Now, it's very important no for men na ma-maintain yung sexual function because I mean it's part of human nature as well, and of course not just for men per se, also wives. Nagugulat
Yes.
ako sometimes kasi pupunta ang patient sa akin, oh sir, bakit ka nagpunta sa akin? Merong problem sa prostate, ganito ganyan. Yun pala, may problem na with sexual function, and the person who encouraged the husband to go and seek medical professional is the wife.
Yes,
So
kasi siya yung
sometimes,
affected.
affected both no? So
Yes.
that's why prostate health is very important. Not just for men, the person himself, but also their partners in life. Okay?
Yeah, so yun no, narinig natin kay Doc no. So hindi lang siya just dun sa urinary concern but also of course yung sa sexual relationship no, especially those who have partners or spouse na no. So medyo pala yan no, talagang crucial para sa mga lalaki if they have prostate issue. So having said that, Doc, what are common signs or symptoms naman of prostate issues that men should be aware of? Para alam mo yun, para yun nga, they can already consult professional welfare katulad mo na para ma-avoid.
Yeah, so number one, ang pinaka-importante na babantayan nyo is kapag may dugo sa ihi. Now, if you see blood sa urine, immediately go see a medical professional. Okay? So aside from that, no, kasi yung blood sa urine, it can mean a lot of things eh. Number one, baka prostate cancer yan. Okay, number two, syempre aside from the prostate, no, baka merong urinary tract infection, may obstruction, like kidney stones, no, na napunta doon sa urethra. Now, aside from that, urinary function. Okay? Typically, nahihirapang umihi. Paano nahihirapang umihi? Number one, ito, iba-iba to, no? You can just feel one symptom or a combination of symptoms. But typically, ang kadalasan na napapansin ko is urinary frequency. Ibig sabihin, ihi ng ihi. Bakit? Kasi ang bilis mapuno ng pantog. Okay? Kasi yung urine, when you urinate, yung urine hindi na de-drain completely from the urinary bladder. That's why, mabilis siyang mapuno. Kung mabilis siyang mapuno, you'll go to the restroom more often. Another is when you are urinating, hirap lumabas yung ihi. So, ang tendency, patients would have to strain just to force the urine out. So, weird, no? Usually, during, ano lang yan, pag dumudumi ka, pero during urination, patients can experience that. Kailangan mo umiri para lang ma-force out yung, yung urine. So, you can just imagine. Another one is at night, no? Frequent urination, yung tinatawag nating nocturia. Typically, ang warning sign dyan is kapag if you wake up at night, no, 2 times or more, just to urinate. And this is considering na hindi ka naman malakas uminom ng tubig prior to sleeping. Okay? So that's also something na alarming. And if you do experience interruptions sa sleep just to urinate, at least twice at night, no, that's also a warning sign that hey, there must be something wrong, right? And lastly, of course, yung sexual function bumabagsak. It's because of low testosterone levels. Okay, so those are just some.
So yun, no? So we should be mindful pala dun sa ating urination, no? So if it's very hard for us to urinate na, nandun yung force, yung tension para lang maka-urinate, no? Also, yung mention ni Doc, yung frequency rin. And of course, yung sa sexual performance, no? So siguro yung sinasabi ni Doc doon nawawalan na ng ando siguro yung desire, pero yung organ hindi relate dun sa desire. So I think that's what Doc Jansen is referring to pagdating dun sa sexual effect nung prostate, no. So Doc, kung ito yung mga symptoms na nakikita natin, normally sa anong age group ba to makikita or mararamdaman? Anong age, like 30 ba, 40 ba? Meron sinasabi, pag ganitong age na, marami na daw nararamdaman di ba? So, ano ba yung age group na pwedeng magkaroon ng prostate issues?
Yeah, it's most commonly found in men age 50 and up. But sometimes, we do see these symptoms already by mid-40s, so 45 paakyat. But hindi sila ganun karami, no? Mid-40s, towards the late 40s, usually when men hit 50 and up, doon na nagsisimula itong mga sintomas na to. So this is also one reason why we screen for prostate issues by 50 years of age, kapag low risk ka naman. Okay? So of course, with screening, that will include yung PSA tests, prostate ultrasound test, no? So just to see how healthy the prostate is.
So 50 years old. So pag 50 ka na, medyo ka pala, no? Actually, dapat naman talaga, pag nasa 50 na, no, kung meron tayong mga nararamdaman, we have to seek professional, mga doctors, diba? Para at least na kampante tayo. And we know, if, sabi nga, diba, prevention is better than cure. So kung alam na natin na may issue tayo, then, diba, we can actually address it and even before lumala siya, diba? So, Doc, kung 50 years old ka at sabi mo yung mga 50 years old na lalaki is prone, no? May mga lalaki kasi na walang prostate issue, no? So, saan ba talaga nanggagaling? Bakit nagkakaroon ng prostate issue yung ibang 50 years old and above na lalaki?
So number one is because of metabolic syndrome. So ano tong metabolic syndrome? Metabolic syndrome is it's a condition, no, that has 4 diseases. So number 1 is hypertension. Number 2, diabetes. Number 3, high cholesterol levels, high triglyceride levels, no? And lastly is obesity. Ang pinakamalala dito sa tatlong ito is obesity. Okay? And why is it so? It's because if you have these conditions, nagkakaroon ng hormonal imbalances, especially with obese individuals. With obesity kasi, the fat tissues also produces hormones like estrogen. Okay? And With estrogen, kapag mas maraming estrogen ang napoproduce, it disrupts yung hormonal balance ng prostate. So, to compensate, no, the prostate usually enlarges. Okay? Because of course, aside from the hormonal imbalance, yung inflammation din that is brought about by obesity, by diabetes, by having high blood cholesterol level and triglyceride levels. Okay? So, ito yung main reason actually behind it why males develop prostate issues. This includes yung benign prostatic hyperplasia, yung BPH, prostate enlargement na tinatawag na benign, and of course cancer as well, especially cancer. Kasi with cancer, there are nutritional factors, dietary factors that contributes to the increase of having prostate cancer. Okay, so katulad ng egg consumption of eggs, okay, it increases risk of prostate cancer. Dairy consumption, cow's milk, cheeses, kasi may hormones ito especially estrogen. Okay, so this can disrupt yung hormonal balance and increase yung risk of developing prostate cancer. So, as we age, okay, bakit 50 and above? Kasi these factors develop over time. And of course, with food, kapag ka naabuso yan, eventually you'll develop metabolic syndrome, then develop prostate issues later. Okay, so that's why prostate issues typically we see them at 50 and above. Kasi yun nga, these factors, yung mga risk factors niya, take time to develop, like obesity, hypertension, diabetes, high blood cholesterol levels, and dyslipidemia. Okay? So, that's the main reason.
Yan. So, agree naman tayo doon kay Doc Johnson, no? Siyempre, as we age, no, nag-a-accumulate na rin talaga yung mga toxins, 'di ba? Na because of our unhealthy lifestyle. Yan. So, sasabihin nyo, bakit meron akong ganito, 'di ba? Yung iba hindi. So, we differ kasi dun sa lifestyle natin. Maybe we have the same age, pero magkaiba naman tayo ng lifestyle, 'di ba? Kaya nag-a-arise na diyan yung mga metabolic syndrome na sinasabi ni Doc, inflammation, no? Kasi magkaiba nga tayo ng lifestyle, magkaiba tayo ng diet, 'di ba? Magkaiba tayo ng physical activity, ng movement, no? So kaya nangyayari yan. So it doesn't mean na 50 years old ka, kung healthy ka naman, yung lifestyle is healthy, prone ka sa prostate. Yan. So maganda rin yung in-explain ni Doc Johnson, no, na you don't have to worry na 50 years old ka, pwede kang magkaroon ng prostate, yes. Pero depende pa rin yan sa lifestyle mo, sa quality ng lifestyle mo, di ba? And that leads me to the question, Doc, can you elaborate yung role ng diet and lifestyle in maintaining good prostate health?
Oo, katulad ng nabanggit ko, no, the reason why we have prostate problems is because of metabolic syndrome and inflammation. So, in preventing or at least reversing yung metabolic syndrome, diyan papasok yung lifestyle kasi yung yung risk factors niya are all lifestyle related. Okay, hypertension, diabetes, high blood cholesterol, tsaka yung obesity, lifestyle related lahat itong apat na to Alright? So, number 1, nutrition. Kung puro processed foods ang kinakain mo, guess what? You'll develop hypertension. Kasi ang taas sa sodium yung kinakain. Number 2, kung processed yan, ang taas sa ang taas usually sa sugar niyan, tsaka sa fat content. Guess what?
Yes.
What will happen? You'll develop diabetes. Okay? Tapos since you're eating junk foods, ang taas sa oil, no, you're consuming a lot of fried foods, abuso sa animal food products, so yung mga red meat na yan. Guess what? What will happen? Tataas ang cholesterol levels. Okay? And of course, lastly, with all these, no, if you are consuming too much food, sobrang taas sa sugar, sobrang taas sa fat content, you'll become obese. Okay? So, if you develop the 4, tataas talaga yung risk for developing prostate issues. Even now, what if okay naman yung diet mo, nakokontrol mo naman, hindi mo naman siya inaabuso. Pero sedentary ka, hindi ka nag-exercise. That can also contribute to prostate problems, especially if you lack sleep. as well. So why is sleep important? Kasi sleep, um when we sleep, no, especially when we go into restorative sleep, diyan nag-heal yung body natin eh. Diyan nililinis ng katawan natin yung mga waste products, yung mga waste materials, to remove it from our body. So if you lack sleep, so you'll give less chance, less opportunity for your body to clean all those waste products. Aside from that, tataas yung stress levels mo. So when you are
Yes.
stressed, yung cortisol tataas. So cortisol is a hormone, it's a stress hormone, no? Na ang effect is to increase your blood sugar levels. So kapag tumaas yung blood sugar levels mo dahil ang taas ng cortisol, what will happen? Eh kung sedentary ka, hindi mo nagagamit yung energy, di ba? You'll store it as fat. If you store it as fat, tataas ang timbang. Okay? And aside from that, you'll also develop, itataas yung risk for developing diabetes, itong high triglyceride levels, no? Pati liver affected dyan eh, actually. Hypertension as well. So, you'll develop yung metabolic syndrome na naman na apat. So, babalik at babalik doon eh. So, just for everybody's benefit, no? What should you be doing to prevent this metabolic syndrome? Eat right, number one, no? So, eat a plant predominant diet. Huwag masyadong malakas sa karne, sa processed food. Okay lang naman kumain once in a while, basta wag lang araw-araw. Importante, ang kinakain lagi dapat plant heavy. Okay? Plant predominant, ika nga, no? So when I say plant predominant, the food that you should be consuming should be coming from vegetables, whole grains. Ang mga halimbawa ng whole grains, brown rice, oatmeal, no? Itong mga to. What else? Legumes, no? Beans, nuts, and seeds. Important din yan. And lastly, fruits. Okay? So, your diet should be centered or revolving around those. And yung iba namang mga pagkain na love natin, so it's okay to eat them once in a while, basta wag lang marami. Okay? So, aside from that, exercise. How much physical activity should you be doing? Moderate intensity physical activity, 30 minutes lang every day. Or if sobrang busy mo, you cannot allot 30 minutes, then 75 minutes. 75 minutes per week lang. So that's 25 minutes every other day, no? Na vigorous intensity. So you can do that. And of course, very important then that you do resistance exercises like weightlifting, calisthenics, no? So these things. Or at kung hindi ka naman talaga makapag-exercise, sobrang busy, then just try to prevent or interrupt prolonged sitting. Huwag masyadong matagal na nakaupo. Okay, so tayo-tayo din, lakad-lakad din from time to time. And
Galaw-galaw
lastly,
din.
Oo, correct, no? And lastly, itong sa sleep, you should be sleeping at least 7 to 8 hours every night, no? 7 to 8 hours yan. It's not 6. 6 is sleep deprivation, okay? It's 7 to 8 hours. If longer, hindi rin pwede. So, kasi if you sleep longer, tendency is tataas din yung timbang. So, 7 to 8 hours is the sweet spot. Okay? So, those are some tips.
Yan. So, thank you, Doc, doon sa mga tips mo, no? Actually, ang dali naman talaga niyang gawin, no? And I believe hindi yan expensive, di ba? Yung tamang pagkain, sabi nga ni Doc, plant heavy, no? Actually, pag ina-analyze mo, mas nakakatipid pa nga tayo compared kung bibili tayo ng mga steak, di ba? Ng mga processed food, no? And yung pang sinabi ni Doc, yung manage lang natin yung mga physical activity. Huwag nating i-force yung sarili natin dun sa intensified physical activity tapos nawawalan tayo ng motivation because ang hirap, ayoko na, 'di ba? So, manage lang natin. Yung sabi ni Doc, no, 20 to 30 minutes every day, yung brisk walking, no, kung pwede, kung malapit lang, if you're staying in a condo, malapit lang yung office, try to walk lang. You don't need to run, no? You don't need to rush. Enjoy, 'di ba? Tapos yung sinabi rin ni Doc, yung sleep, yan. Ang dami sa atin yan, guilty, hindi na natin nagagawa yung 7 to 8 because of what? Ang dami kasi nating ginagawa na nasa gadget, 'di ba? So ang nangyayari, hindi na natin napapansin, lumalampas na yung sleeping hours natin, 'di ba? Sleeping time rather. Then I think Doc, 'di ba dapat 10 PM tulog na tayo?
Yes, actually, no, by 10 p.m. But sige, pagbigyan natin yung mga ano natin viewers, sige, until 12 midnight. But as much as possible, no, by 10, 10:30, yan, siguro ano na 11 p.m. dapat ano na yan, dapat tulog ka na.
Yan, kasi doon nagre-repair yung mga body organs natin. So, kung gising tayo at kailangang mag-repair ng body organs natin, syempre nagkakaroon din ng struggle, di ba? So, walang quality rejuvenation yung mga body organs natin. So, be mindful yung mga tips na binigay ni Doc, no? Food that are plant heavy, meron tayong physical activity, wag tayo yung potato couch, no? And of course, yung sleeping natin. And these are all, no, especially yung sleeping at saka yung exercise. Libre naman yan. We don't need to go to the gym para naman magkaroon ng 20 o 30 minutes exercise by walking kung gagawin mo siyang regular, no? So, libre naman yan. So, we just have to really manage and have a quality lifestyle. Yan. So, Doc, I know naman na hindi lahat ng mga individual can attain that good and quality lifestyle. And for sure, no, yung mga 50 na men and above, magiging candidate talaga sila for prostate health. So yung mga lalaki na meron ng prostate issue, ano naman yung, how does it affect, no, sa mental health nila? Paano, yung nai-stress ba sila? Ano naman yung epekto nito sa mental health?
Oo, definitely. No, na-stress sila kasi yung mga bagay na nagagawa nila before, biglang hindi ko na magawa. Okay? Tapos, syempre, especially when it comes to sexual function, yun talaga usually ang pinakamalaking issue aside from urinary function, no? Kasi syempre sexual yung sexual performance kasi pleasure yan eh. Kapag hindi mo nagagawa, affected yung guy, pati yung partner, yung wife, no? So ano talaga, it can strain relationships, it can be a source of frustration. Okay? So aside from that, syempre, one of the basic function, which is urination, yan din yung isa pang nakaka-disrupt the quality of life. So typically, if men experience these things, it can lead to anxiety. They sometimes they can be stressed kasi bakit hindi ko na magawa, tapos maya pupunta ako na CR, so they can be more anxious more often than not. And yeah, so yan ang impact sa mental health, no? So that's why it's very important talaga if you feel these symptoms, kailangan magpagamot agad. And just be patient, no? Eventually it will get better. Like yung sa testimony natin, si engineer, 'di ba? He experienced it since 2022, but prior to 2022, I'm sure may mga nararamdaman na siya, 'di ba? But it takes time. So you just have to be on the treatment, make sure na compliant ka. It can be there can be challenges while you are on medications kasi may mga side effects yan eh. So say one example, no, is we have certain medications to shrink the prostate, to reduce the size of the prostate, na ang nagsasuffer is yung sexual function. May ganun. So now we have to, of course, we have to shrink the prostate first. Ibalik natin siya sa original na size bago natin i-address yung sexual function. Kasi kung hindi natin paliliitin yung prostate, tayo agad sa sexual function tayo agad, the problem will not go away. It's gonna be there and you will be dependent on medications na nag-raise ng flag ceremony, di ba? If you know what I mean.
Yes,
diba? And
yes.
of course, these medications have side effects as well. You cannot be on it for a very long period of time, no? So these are the things na very important. And more often than not, yun nga, it can really affect the mental health of males negatively. Kasi because of these factors, no? So important talaga pag nagkaroon na ng symptoms na ganito, go see a medical professional, be on the treatment, no? Adhere to the treatment. Yan ang pinaka-importante sa lahat. Kasi walang kwenta, pumunta ka sa doktor, di mo naman sinusunod, di wala rin, di ba? So that's it.
Yan, so we heard it from Doc Johnson, no? So if you will not take care of the issue, then it will really affect you, no? Nagkakaroon ka ng anxiety, nagkakaroon ka na nahihiya ka, nawawala na yung self-confidence mo because of the issue. But just like what Doc Johnson said, no, there is a solution. You just have to admit yourself na you have the issue and seek, no, professional help from a medical doctor na katulad ni Doc Johnson. Kasi sabi nga, no, wag parang ano ba, magpapacheck ka ba bala dahil dun sa sexual issue o i-address muna natin bakit wala kang sexual desire. Hindi nag-a-arise yung ano mo, 'di ba? So doon tayo be patient. Yung sinabi rin ni Doc Johnson, no, be patient. Let's address first the issue. Then pag na-address na yan, then it will follow na rin yung issue mo about dun sa sexual concern. No? So, yan. So, napakaganda ng discussion natin, Doc. And I know yung mga viewers natin, may matututunan talaga dito. And hopefully, no, hindi na i-increase, no, hindi na tataas yung male with prostate issue. So, before we wrap up, I know busy ka rin, Doc. Could you share some advice to our viewers on how they can maintain, no, their overall urological well-being?
Yeah, so siguro as a summary na lang, no, with all the things that we've discussed. Okay, so again, prostate issues arise because of metabolic syndrome and inflammation. So, what is metabolic syndrome? Hypertension yan, no? That includes four conditions: hypertension, diabetes, dyslipidemia. So dyslipidemia includes what? High triglyceride levels and high cholesterol levels. And lastly, obesity. So these four are all lifestyle-related diseases. Okay? So by lifestyle, ibig sabihin, ang mga sakit na to nakukuha sa kinakain, how often you exercise, physical activity level, no, and how well you sleep. Okay? So for nutrition, ano dapat ang goal natin for food? Dapat plant predominant. Okay? And as much as possible, limit intake of animal food products and processed foods. So for physical activity, make sure that you break prolonged sitting. So prolonged sitting is sitting for at least 2 hours or more, no? So make sure also that you exercise. So dapat 30 minutes of moderate intensity exercise every day. Or if sobrang busy, then you can shorten it to 75 minutes per week. Per week, 75 minutes per week of vigorous intensity physical activity. Okay, so aside from that, make sure you are sleeping well as well. So ang sleep dapat 7 to 8 hours yan every night. No? So if you experience difficulty in sleeping because of the urinary problems, then very important, you go see a doctor. And when you go see a doctor, do what the doctor tells you to do. So kung kailangan magpa-laboratory, please have it done. Kung kapag binigyan ng gamot, take them. And adhere to the treatment. And make sure you also follow up with your doctor para ma-monitor ka. And if there are certain things that needs to be adjusted doon sa medication, it can be adjusted. Okay? So those are just a few tips, no, as a summary in order for you to maintain yung prostate health. At saka lastly pa pala, isa na lang, no, I think this is the most important of all Dapat loyal, isa lang ang partner, okay? This is of course number 1, to maintain healthful relationships para ma-maintain din yung mental health ninyo, okay? And lastly, it's to prevent infectious diseases from acquiring infectious diseases, itong mga STIs or sexually transmitted illnesses na tinatawag. Okay, this is for you and also for your partner. Right? So, that's it. No, thank you, Ms. Peachy.
Thank you, Doc Johnson, no, for sharing those tips. No, and again, doctors, medical practitioners they are teacher. No, they teach us the proper way how to prevent any health issues, how to address health issues, and how to be really healthy. It's all about us, no, na yung sinabi ni Doc, sundin natin para ma-resolve natin yung issue. So, yan. So, Doc, I want to extend my sincere gratitude for joining sa aming Mass Talk, no. So, first time natin makasama si Doc Johnson. And actually, when Marichu told me about Doc Johnson, alam mo ba nakita na kita sa mga feeds ko before before. So sabi ko, parang familiar siya, Marichu. Tapos sabi ko, parang nakita ko na siya. I don't know kung nagti-TikTok siya, but I'm seeing him in his feed, no? And I really appreciate mga doctors that using this platform, no, to promote well-being of mga individuals, no? So thank you again, Doc, for joining us and sharing invaluable insights on prostate health. Of course, your expertise added depth and clarity to this crucial topic. So thank you ulit, Doc.
Thank you, Miss
Yan.
Peachy. Thank you for having me.
Thank you, yes. So in closing, it's evident from our discussion today that prostate health is a critical aspect of overall well-being for men. Understanding the signs, adopting a healthy lifestyle, and being proactive about screenings can contribute significantly to early detection and effective management of potential issues. Remember, open communication with healthcare professional is key. And seeking regular checkups is a proactive step towards maintaining a healthy prostate. Let's empower ourselves and our loved ones with knowledge, okay? Dispel any myths about prostate health, no, and encourage a holistic approach to wellness. Thank you for joining us today, and please do share this link to your loved ones and share what we have learned today. So again, thank you for tuning until the end. We'll see you again next week, same time and same channel. Stay safe, stay healthy, and stay blessed. Thank you.